Well, welcome to the Lab Voices. My name is Umar Ansari. I'm part of the digital health team. I look after our clinical solutions. Today, we're going to have a very interesting talk about one of our leaders in the Middle East, specifically in Saudi Arabia, and what they did to ensure that they're using analytics to improve the overall workflow of their lab. So a little bit about Abobaker Yagoot. Abobaker is originally from Eritrea. He did his studies in Egypt and continued to study in Canada. After he finished his studies in Canada, he moved back to Saudi Arabia, where he worked for King Faisal Specialist Hospital. The King Faisal Specialist Hospital is actually the first HIMSS Level 7 hospital in the Middle East. After he finished that endeavor, he moved on to National Guard, which is the largest military hospital. And there they've been using, we're the early adopters of analytics and DHS systems to ensure that they're improving their overall operations for lab. Now, before we start, just wanted to put up our disclaimer here. So the support for this program is provided by Abbott. However, all the views and outcomes are real-time outcomes from what they've experienced at the National Guard Hospital. With that being said, I'd like to introduce Abobaker Yagoot.
All right. Thank you. Thank you, Omar, for the kind introduction. Thank you all for your time. Just like it says, this is going to be an end user experience. So that means I'm going to share with you a screenshot, printout, and I'm going to even throw a couple of videos here just so you can see exactly what we're doing. Instead of telling you, I'm just going to show you what we are doing in our hospital. Now, after disclaimer, Omar took care of it. I'm just going to introduce you to our organization and then a digital health solution in general. And then I'm going to talk about 3 areas in digital health solution that is pain points to the lab and how we solve it. And I'm going to show you just examples, real life examples. It's not going to be like, this is what we do, but exact things. And then at the end, we're going to talk about, is there a value added to the lab by implementing those solutions? Now, our organization is the Ministry of National Guard. There are 5 hospitals plus 2 more hospitals coming. And the hospital that I'm talking about, the one that we're going to show you what we did, is the one in Jeddah in Saudi Arabia. And our laboratory is, actually the hospital is a tertiary care hospital. It's in a medical city, about 1,000 beds. Our laboratory is, we're talking about just the clinical chemistry. Everything that we talk about now is going to be about the automation area. We have also a special chemistry area, but we're talking about only the automation area for today. We run about 7 million assays per year, and we have all those accreditations, local and global accreditation. Now, our laboratory, it serves our main hospital, which is about 1,000 beds, 5 primary health clinics, home health care, 2 dialysis centers, the Jeddah Dialysis Center and Mecca Dialysis Center. So I know a lot of people, they're talking about the pre-analytical problems. We all suffer from that. If you've ever seen any pre-analytical problem or if you heard about it, we see it almost on a weekly basis. And I see a lot of people are talking about Indexor. We're looking for so many things to solve those issues. Now, about healthcare, my introduction would be, like I said, this is our experience. I just want to share like my definition of digital health solutions. When you say it's just something that turns the laboratory data into information. Everywhere you go, like statistics, let's say you want to do a turnaround time, and Excel can do it for you. But is this a solution? Is this a software that I can take all my data and put it in that software, and that software can turn for me my data into information? That is what I can optimize the workflow. I can streamline my inventory, and that's where you can elevate the lab's work. Now, we're going to introduce you about 3 digital health solutions that we use in our lab, but I just included that yellow rectangle here to show you that AlinIQ family is more than one softwares. There's a lot of members on that family. And I'm just going to talk to you about the 3 pain points in our lab, which is that when it comes to organization, and by organization, what I mean is not the organization part of the lab, but organizing your samples, your auto verification, your repeats, and all that things. As in another inventory area, this is the area where a lot of people have the pain points in it. And we're going to talk about the analytics, how you calculate your turnaround time and how you investigate it. So we will go down. So these are all the members. We're just going to talk now about the analytics. And then I'm going to talk a little bit the other member of the family, which is the Inventory Management System. And then we're going to talk about the AMS, which is the middleware. So we're just going to talk a little bit, anything about how those things work. You can see it all, it's all over around here. People are explaining it. My presentation is going to be just to show you how we use it in our lab. Now, this is it. Now, most of the things that in the lab, if you don't need it, don't use something. So what is the need? We did a presentation before that how this thing helped us to calculate the turnaround time, how much time it was taking us to calculate our turnaround time. Today, we're going to talk about what is this going to help me to investigate my turnaround time. Let's say turnaround time was 80% of the samples were verified within 1 hour. Now, is 80 good? Maybe you were aiming for 90. So how can this software help you to investigate, not just to show you that the calculation? And if you have an analytics providing you with the insight to investigate, that's what we're looking for. And that's what we call a solution, not just a software. So like we said, if you see around here, this is our hospital. This is how it looks. That's my email. Once you log in, starting from this slide, you're into National Guard. That's it. You're in our hospital. You're not in Abbott anymore. So I know you guys flew from all around the world to come to Chicago for this thing. Allow me for the next half an hour, I'm going to fly you to Saudi Arabia, and I promise I'll bring you back. So just consider this is like an investigator coming to our lab, and you will see everything. The only thing we're going to learn, either I'm doing it wrong or you learn something. So it's a win-win situation in any case. Once you go, you will see this is what it tells you. And some of them have a drop-down menu. Okay, so like demand, productivity, and all this. I'm going to show you the ones. Once you click, there is more than one. And I'm just going to concentrate now on the turnaround time and how we investigate. Now, this, what it is, 1, 2, 3, 4. This is your demand, your productivity, everything. The demand here, and I can move a little bit just to show you. Demand is telling you how many patients, how many samples, how many you did, and you need that for your statistics. And if you're talking about your productivity, that's telling you your cost per manpower, your cost, and all these things that has the finance, which is going to need it, but we're not going to talk about it. Analyzers, that is telling you how many assays went on each analyzer and what time that analyzer was working. So if you have a new tender coming on and you want to make a decision how many instruments you want to sign for, that is going to give you the information. For now, demand capacity alignment, is your staff coming at 8 o'clock, your sample is coming at 9, and the people are sitting, they're not doing, or vice versa, samples are coming and they're waiting for 1 hour. So that can show you how that thing is aligned. Excuse me. For today, we're going to talk about the turnaround time. So what I'll do is I'm just going to take, this is small, I'll take this with me to the second slide. This is a bigger side. Now, the only thing you need to see is that goal is 98% of our goal. There are 2 columns here. This one is saying about 1 hour. That's for a stat. And this is a routine, 4 hours. Meaning that our target is 98% of any sample that walks into the lab and is ordered as a stat. 98% of those samples have to be reported to the physician within 1 hour. And same thing goes for routine within 4 hours. So we're going to talk about this. Now, sometimes, a lot of times in the lab, we do KPIs And we keep repeating, but we don't get any benefit from that. What is happening? Are we solving it? And you see the same. Maybe the 98 is not realistic. Maybe we cannot achieve it. So how do you know that? This is what I call the information. See, time to reach the goal. This one, it took me 1 hour and 4 minutes to reach the goal. So I can say, it's okay, I can leave the 98 and I can work on that. So that's just an extra information. Now, this is for the quarter that you go to the system and you can check per month, per quarter, but whatever time that you want. And it will compare it to you to last year's the same period. So this is what this is. That's what's telling me. This is for April, May, June, 90 days. And this is what we achieved. We are less by this much compared to last year. Now, here's the scenario. We can sit with the higher management and you're talking about your turnaround time. The first question they'll ask is, why you didn't achieve 98%? That's your goal. And then you will say, well, on those months, we had an interface issue. We had a few days that the network was down. Those are all, it's just all reasons, but we're not pinpointing exactly what happened. Like if you're Saudi, you can say it was Ramadan time. In Ramadan, a lot of things are slow. Here, you can say it was Christmas time, Christmas, New Year, things are slow. So you can say anything because you're not showing exactly what happened. And the beauty of this is, what if I can break down this one into days instead of like 3 months and to break it? So once you see that arrow here, you click on it, that means it will dig down, it will take you to the next level. We have one column for 90 days. And if I click over there, excuse me, you can see 90 days. Now we know exactly what happened. Now, I just want to explain that dotted line means the turnaround time goal. You have the achieved, those are the green, and the columns are how many assays we run. So imagine if I had told the management that there was any reason. No, all the times it was good. And this is a normal lab. So sometimes you're aware, and there are a lot of days that you can have some issues. But the worst day is this one. So let's just see what happened on that day instead of talking to the staff and say, listen, in this quarter we have an issue. How can we reduce it? How can we improve? But now we know it's not the quarter. So now that we have one day that is very bad, let's see what happened on that day. Maybe we can bring the staff that were working on that day and ask them, hey, what happened on this day? Why the turnaround time was bad? What about if we can investigate a little bit further instead of talking to the people? Once you click on that one, those are the 90 days. That red is the day, but it broke it down for me into 24 hours. So it's good that we didn't say to the staff, hey, on that day, your turnaround time was bad. But look at most of the day, every hour, this is from midnight, 0, and the 1 a.m., 2 a.m., everything was good. We had an issue at 10 o'clock. So maybe we can see who was working on that evening and we can say, hey, guys, you went for dinner, you left the samples, it was delayed, whatever. But that's not all. Let me just forward this. It's going to show you exactly what happened here. It's telling you 58%, 33 samples were 33 assays. Now we were at the quarter, we're almost down to days, hours, assay, what happened at each hour. Now, once you see this, it breaks it down for you. These are groups. You don't have to talk to the people. Number 3, here is telling you this group, that black group, is one assay took 5 hours. And then the other one, the green here, is just a group that is telling you 31 assays took 2 hours. Okay, and there is one assay that took 5 hours. Now, on top of that, if you can talk to people, okay, so what else happened? Which samples was that? It gives to you this all count. That is the definition for the sample ID. What sample that assay came from? Which sample? Was it an ER, test priority, test code? Everything, it tells you exactly what happened. So at this time, maybe there is not a problem with the lab. Maybe it wasn't the turnaround time delayed. Maybe, and a lot of times we say problems are pre-analytical. Maybe ER, they have a new nurse, they're having a problem. Maybe they're sending the samples quickly and it's clotting and it's blocking the probe. The people, or those two people who are working at evening, they change the probe, they recalibrate it, they run a control, and they run the samples, and they still were able to do the 31 out of 33 analysis within 2 hours. That's taking the day shift 7-8 hours or more than that. So now this is what we say. Instead of saying maybe we don't have a problem, you'll say thank you to those people. You start sending emails to an emergency, see what's going on. If they have new staff, they can retrain. Now you have a turnaround time problem. Instead of traditionally that we're blaming the lab, we're talking what happened. Now we have a software that changed our data into information, and we were able to make a decision. We can solve it from the pre-analytical. Now, this is just one example of one of the members. There's a lot of things here, but because of time, I just giving you an idea. It's just the ability of dig down to get to exactly what happened, instead of just talking and say, we need to improve it next time. Now, we're going to go to the second member. We were talking about this one. Now, I'm going to start talking about the inventory. We have an issue. And this is what I was talking. That's the same slide we saw at the beginning, just to keep that picture. This is the one we talked about now for the AMS. The other one, we're going to talk about the inventory management, and then we're going to talk about the middleware, just to keep that little picture. Now, with the inventory management system, again, if you want to know how it works, the functionalities, there is a lot of books here. My job here is to show you how we use it, how it works in our lab, and I'm going to show you a practical example. Again, what is the need? What is the problem? When I go to make an inventory, you need the time, you see how many you need, what was the previous time. And when you follow your inventory, that you want to make sure you scan the inventory, how many is left. But there's a big problem that we all face in the lab. When we get our shipment, we get our 4 months shipment, boxes are all over. You have to open them, you have to look, you have to compare them with the bills, and it takes a lot of time and a lot of effort. Now, what I would show you is, again, I am logging in. So from now on, you're into our lab. You're going to see exactly what we're doing. Once you log in, it's going to show you this, which is that thing over there. So anything, whether you're with any company, you talk to the company, they'll explain to you. I will show you the practical of what happened. The thing is, when receiving shipments, I'm just going to talk when receiving shipments, and I'm going to talk about 3 tasks. The time to complete the task, how long it's taking us when we get our shipment to the big boxes, number of staff required, and some potential risk that not many people think of. After AlinIQ, that is just a give or take. It depends, like maybe I said 2 to 4, maybe it's a 3 to 5, depends on your shipment and your lab. It was taking us, the senior medical technologist, to receive those samples, a full shift of 9 hours. And sometimes he leaves boxes for the next day because he get called, there's a problem with results, he's talking to physicians. Number of staff that were helping him, the senior technologists, Abbott engineers. Now, we have Abbott in our lab. We have hematology, serology, and chemistry Abbott. So we have a resident engineer, and we're always together. Sometimes he's not busy, and he just helps with the boxes. So you're involving other people. Drivers, we have drivers. There are 2 drivers. You're going to see now, I have a little bit of video to show you that they bring, but they have to finish. We have to sign the papers for them so they can go. So, and the truck is sitting in the lock-in dock, and they need to move it. So they're also in the rush. Housekeeping staff, sometimes they start moving the boxes because there's so many boxes we're opening there. Students, we are a teaching hospital, and sometimes the students, the senior technologist is teaching them, and he's busy. The day he's busy, they come and help him. And depending on the day, you get to see one of these people. On top of that, the hallways are narrow and a lot of boxes sitting there. Is a fire evacuation safety issue. The safety guys are coming and say, what are you guys doing? Delivery truck on the lock-in dock. We're a military hospital, and we have the military police that go around with the cars they drive, and they see truck waiting there, and they say, come on, move it, so another truck has to come and deliver. So all these things that people, they just think inventory, oh, I came today, was very hard. We signed the papers over. Let's just wait for next. But you don't think about all these things. At the end, when you add all this, that's money, that's time, and that is effort. Now, I'm going to share with you 3 small videos. This is classic honesty, and like when you show people, even the things that we don't have document, I have them on video, and I'm going to show it to you. You will see a lot of flows that doesn't make sense, but that is out of confidence. We have also another system that we monitor, and we're okay. But just think about any other lab. This could happen in anywhere else. I'm going to show you how, this one is going to show you how the corridors are narrow, how boxes are there, how it's fire hazard, which nobody thinks about when you're talking about inventory. I'll show you there are 2 drivers here and the senior medical technologists, and they're discussing and they're saying, oh, this paper is for this boxes, this one is for here. Oh, I haven't signed this, I didn't see, you forgot these boxes, bring it. And I'm going to tie up for you this. A lot of times we hear in the lab, they say, this thing helps the lab and beyond, or this thing can improve things in the lab and beyond. But nobody ever tells us what is beyond the lab and the phlebotomy, the lab and the physician, the lab and who. I'm going to tie up for you what happened in this. I'm going to tie it up for you for the company's head office revenue or the hospital's expense. It seems so simple, but you will see how it affects. And then I'm going to show you with AMS, and you will see him scanning. Just because it's an RFID tagged reagent, then you're not going to see him scan 1 box at a time. He's just going to go raw. This is the first one. You see the guys passing by. It's very narrow. Safety. There's fire. Where can you go? Nobody connects that to inventory. This is real. This happens in a different version with all of us, many labs around the world. That's another guy. He's coming now because he forgot some boxes. That's bringing them. If you're busy, you didn't know you signed something. Instead of 100 boxes, you received 80, but you signed for it, and so on. And you can see here, they're going to talk. They say, oh, I didn't receive this. This is hematology. I didn't see. But the idea here, these 3 people, the last thing they want to do here is stay more time here. They're busy. People are calling them. The police are bothering them. And they have nothing to do with the amount of money involved. But here, it's either going to affect the hospital or the vendor, and they want to be out. Those few minutes are going to affect, this is what I want to show you, that how it relates lab and beyond. Let's say we're in an Abbott booth here now. Let's say Abbott management in Chicago, they're talking about the revenue. They say, well, what if this guy brought 100 boxes, but the warehouse put 80, or vice versa. So you're talking about your revenue at the end of a quarter, and you say, well, this is 1 hospital. How many? We have 7 hospitals. How many hospitals in the region? How many around the world? You're talking millions. Now, when you're talking, you say, this was my revenue. Where is it? Or it could be the other way. Maybe there was less boxes, and now on the hospital management are sitting and they're saying, well, this is how much it costs us to operate the lab. Is that what it costs you, or there was a lot of things that you did not receive? So this is a good example what it shows, the lab and beyond. And this is where vendors and hospitals can sit together. Hey, look, we have a system. This is how much it costs us, but it is going to affect all of us. If we go to this price and we can implement it, now you, the hospital people, are not going to spend money or think that this is how much is going to your operation. You will actually know, and the vendor will actually know this was my revenue. Now I'm going to show you with the AMS how much it takes. That's the housekeeper, by the way. He walks in and he says, what's going on? You don't need me today? I said, now, what he did, he was scanning. Actually, that was just an example. I came from lunch and I asked him, just keep the rest so we can show you how he's scanning. But it's not going to take you this few seconds. It's going to take an hour or maybe 2 hours because you need to move. But at least you're not going to scan 1 box at a time. right? So this is a lot of saving on time, manpower, effort, and we even showed us beyond the lab how it is going to affect. So I'm going to take you to another member of the digital health solution, and I'm going to show you real-life examples. Now, this is the AMS, is a middleware. I'm sure everybody has middleware, and it's all different companies that work different. I'm going to show you. So now, what is the problem? Is this bi-directional? How we can use it. When you have a medical technologist in the lab, you train them. You say, when the sample comes, please look at it, make sure it's not hemolyzed, then run it. If it's slightly hemolyzed, look into it and just add a comment when you're sending it to the physician. Say, interpret result with caution. Sample is slightly hemolyzed. If it's grossly hemolyzed, it will be blocked, or don't run it. Call the physician, ask for another one. And then look for delta check. Look for all the rules. So, and then at 3 months, you evaluate that person and they're doing okay, and they sign the contract. A year later, 2 years, human being, there is always mistakes. When you look back, physicians are calling, oh, sample is hemolyzed, you gave me high potassium, but the sample, you take it, you find it hemolyzed, you're asking the guy what happened. As human being, they're going to forget. If you have a system do it for you, then it's consistent. This is a physician, and his office is ordering glucose and creatinine. The order is going to go all the way up to AMS, the middleware. Now, the middleware is being trained to do all these things that a medical technologist was supposed to do. So he needs to know if the sample is hemolyzed or not. It is going to ask the instrument to do the glucose, creatinine, but it's also going to ask to do hemolysis, icteric, and lipemia. And he's going to need all those 3 assays to make a decision. The instrument will give back the 5 assays, including the 3, the hemolysis, icteric, and it's going to use that. If that sample was okay, it's already, you program in the middleware to send the result. If the sample was slightly hemolyzed, we already have the comment, it's going to send it. If the sample was grossly hemolyzed, it's going to stop it for you, deal with it. That is part of the auto verification, and you're only dealing with the things that have problem, not all of them. Now, it's going to send the glucose and creatinine and the comment or the things that it's, but that's not all. It's also good after it looks for delta check, after it looks for critical, that you program it. If this critical, it's going to flag it red for you, and it's going to wait for you. Dilution, you don't have to physician to call you or sample anything that needs to go back and again. Reflex, you have a TSH high or low, you're not going to wait, oops, let's do FT4, and a lot of other rules. This is for the AMS. I'm going to give you another example that we did in our lab as a reflex test. An example with the beta HCG. We're having a communication when beta HCG, it takes a little bit longer reaction time. So the sample is high, it's going back for repeat. You call the physician or they're calling, and what happened? Oh yeah, we're waiting for dilution and all these things. This communication, what if we can do it through AMS? Is it flexible? Can we do for us? Example, beta HCG, if it's for a pregnancy, then there is no rush. It's going to be report he's going to see tomorrow or when they come for their physician. What if there is an accident and there's a childbearing lady that has had to go, she's in a coma or something, that has to go for X-ray? The first thing you check is the beta HCG. If it's negative, if it's low, then that's fine. But what if it's high and it's diluting? You want it to wait. I mean, when you're in an accident and you have to the point where they need to do X-ray, you have broken bones, I think a fraction of a second makes a difference. What we did is once the result comes, send the result to the physician through AMS, but not a number, a comment saying that see comment. And what he wants to see, click what is going to result above instrument range, this, and result dilution to follow. Physician, if he was not looking for pregnancy, he was just looking to do surgery or to do the X-rays, he's going to proceed of what he wants to do. While the second one comes, the second result with dilution, look at this one here. That first one came at 108, and it says C comment, and he saw his comment, and he already treated the patient or sent for X-ray or not, and he looked for another thing. If we were going to wait, the normal way would have been after dilution at 1340. That's a 32 minutes difference. Now, in a normal lab, he would get his result of the beta HCG at 1340, not at 1308. There's a difference of 32 minutes that was saved if that patient could have been a pregnant lady that was in an accident and they figured out what to do with it. This is what I said at the beginning, that I want a digital health solution that helps you, that turns the data, that gives you an information that help, not something that just calculates things for you. Now, I don't want to waste the time. So these are the three things. We talked about the analytics. We talked about how we can check the turnaround time and how we start digging down all the way until we find exactly what happened. We talk about an inventory management system, and we tied it to the two ends that are dealing with the money. And we talk about the middleware and its benefit. Normally at this stage, you would ask a question, but we said now you all flew to Saudi Arabia, you're in our lab, so I get to ask you the question. But I promise you'll come back again. Now, as a question, you're just going to ask in a different stages. What if you are a laboratory director and you have a new contract coming up? This is the time where people want to see which one I want to decide. And you need to choose between an IVD companies, and you want to make a decision based on one specification. You all know before the tenders, we do a lot of two-page specification that the machine does this, can it do dilution, can it do all these things. If I tell you it's going to cost you 10 million, but I'll give you 20 million, you can go do your contract now, but just give me one specification that you're going to make a decision based on that. What would that be? What would you look for between those companies if that was in 1970s? Now, this is another thing to show that the healthcare is changing and improving. What would you look for if that was at this period of time, 90s to 2000? And what would you look for now? Now, the time I just went this time, and then I just went 20 years just to show, but I'm not sure of exactly in the 70s what was happening. But now the thing is, at the beginning, if you all remember, let's say a company would come and they say, you know what, our samples, our machine takes one sample at a time and they do it and it finishes, and then the other one at a quickly. The other company will come and say, oh no, we have 5 racks of 5 samples, it will come. Third company will come and say, you know what, regardless of how many samples we're going, their reaction time is slow. It's not like ours. So they're sitting there anyway. And at that time, we were making a decision based on who has the best instrumentation. FDA came and thinks, but now nobody can manufacture an instrument that's below that the benchmark. So we're okay. Companies grew up and everything started like they opened many places and they have a lot of customer. And it ended up when you call like an engineer or for agents, oh, the engineer is in another city. He's coming maybe tomorrow, so he can come to you after tomorrow. We used to hear that a lot before. Well, I cannot stop the machine for 2 days. You expanded, but you didn't hire enough people. And people were having, and so the one thing people were asking your tenders was, how is their after sales? Now that we established the instruments are all okay, people would think, what am I going to do with that instrument? How is their after sales? That one get to now the contracts get more sophisticated. There's a lot of penalties. Now, if I call, not only I call, I have a resident engineer that is sitting there all the time. Now that we have all the instruments are the same, after sales is almost the same, what would you do? What is it that you're looking for now? If you're in the 2024, you're looking for someone that has the best enablers. That's what we want to do. Labs are busy, they're short staff. Management is telling you just do it whatever you can. You want to look at a company, regardless of what that company is, that can help you do more with less, something that can help you like a digital health solution or anything. One thing I want to add that we realized is in some places, let's say we had an example with AMS, it's downloaded in their machine by artificial intelligence. I mean, all those softwares, and the human intelligence, I mean that the people who are working in the lab, all those softwares are not going to do anything unless the lab, there's a lot of labs that have it in our lab. And we did all this, but you go to walk to the other labs and it's still sitting in their computer, they're not working. And the reason is you have, as a company, you need to go, or as a management of the lab, you need to encourage the people, hey, listen, this is the artificial intelligence going to help you, but as long as you nail it. So at the end, in the future, when you compare companies, the company that is elevating themselves with bringing all these softwares, but not investing on the end user as like a human intelligence, that the software is going to be sitting there, it's not going to be doing. The one that is going up is like what happening like now, where you bring end users together, start coming with ideas, everybody go look for it. Now, this is when you're raising yourself and bringing the customer with you, and the other labs will see that, and there's more people are going to improve. And at the end, is the end user that's going to benefit. Years from now, you will see more labs having those things. Now, from my side, I'm all done for here for today. Anybody that has any question, the microphones are here. Go ahead.
Thank you very much for that. What version of AMS are you using right now?
The first one, we just updated it 2. I can't remember the version 2.0, but I'm not sure.
Have you evaluated the QC package?
The QC?
The QC?
Yes, we evaluated it.
And what are your thoughts?
They're good. Which QC are you talking about? Now we use.
I know I saw you use Unity Biorad.
Yes, that's why I was asking. You're talking about the ones that come with the inbox, or we use a third-party control on all our assays. We're 100% Biorad now.
100% does that give you bidirectional?
Yes. AMS send it to Unity to QCNet, and then we get our monthly report.
And do you write those rules yourself?
Which one? On the Unity or on AMS?
On the Unity.
On Unity, yes.
Okay.
Yeah.
Right.
With the company, of course.
Yeah.
We give them our rules, and it's same with AMS. The rules, we give Abbott the rules, and we can do it together.
Correct. Yeah. Thank you.
Thank you.
So, with the solution that you just shared, I'm assuming you didn't. With the solution that you just implemented, it came in over time. As you implemented the various things, what journey do you recommend another laboratory take in order to implement these things in an effective way?
I talked to someone this morning, a very good question. If you have to start with AMS, the other things are going to save you. You can do anything with the inventory. Everybody has their way. The other thing is calculate for you a turnaround time and investigate. You can say, well, AMS is like replacing a medical technologist with a software. It's going to do the auto verification, all the for you. So now you will have people that can do better things. Then you can use these people to implement the other work. So if you have to start with anything, just start with the middleware. Whether you're with Abbott or AMS or any other company, just start with the middleware.
Thank you.
Thank you. Anybody else? It was clear? Thank you very much. Thanks for your time. Thank you.